Colon cancer is the development or the proliferation of cells in an abnormal way that usually starts as a polyp, which is a small growth in the lining of the colon, and from there, over a period of time, and usually over quite a period of time, several years, these cells become abnormal and develop into a cancer.
It's one of the more common malignancies that afflict our population. It's becoming much more common as people age, and it's also one of the most preventable malignancies that is around.
If we find it early and we treat it early, that we have a high chance of curing patients. But if not, it can spread to other organs, including the lung and the liver, and people can die of it. There have been tremendous advances in our knowledge, our treatment, and the prognosis of colorectal cancer over the last 10 to 20 years. In fact, if we look back 20 years ago, that it was really a deadly disease. The only option for treatment was surgery, and most often the patients presented very late.
There have been advances in terms of introduction of laparoscopic assisted surgery from the surgical side. There are better chemotherapeutic agents. We're far more aggressive even with more advanced disease, and we're able to cure people now that would have been considered incurable 5 or 10 years ago, and that's been really great.
Well, the treatment of colon cancer for many years was primarily surgical, and I think that some of the important recognition that has come up over the past decade or two really is the importance of surgical technique.
As far as prevention is concerned, colonoscopy, 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 awareness and colonoscopy, and I think that that's something that we have to work on.
What is really becoming clear is we're allowing people to live a lot longer with living normal lives. That's probably the biggest advance that's been happening with colon cancer.
My prediction in the future is that every colon cancer, most cancers in general, will have genetic causes, and we will be able to work out those genetic causes and then target therapy to those particular genes that are causing the disturbances.
We have this tremendous wealth of knowledge that just keeps growing at this incredible pace in terms of what makes cancer, and we're all waiting for the day that that makes a huge impact in terms of our care.
You've probably heard of personalized medicine, and that's where we do a genetic analysis on an individual patient's normal tissues and their cancer and try to see what the weakness of their cancer is and then target that specifically. You know, we're a long way from that.
So I think ideally the future is certainly earlier detection for patients. And a lot of that's going to come from patients and family doctors having awareness about the disease, so that the screening programs we've brought in across the province are being implemented pretty well, but I don't think we've quite reached 100% yet. So hopefully the types of cases that we deal with, the more complicated advanced cases, we'll see less and less of that. And in a step-by-step fashion, hopefully the extent of treatment we have to put patients through to try to cure them of their disease would be less and less over time.
We need significant funding from outside agencies to support all phases of research into all different steps of the cancer process and the patient journey.
You know, the big sort of government grants expect you to have 10 pages of preliminary data before they'll give you a grant. So there's no funding otherwise for that preliminary data, which is why the kind of funding that you get from Colon Cancer Canada, to me, as a researcher, is critical.
Outside funding, private funding, is essential to going forward. It's just absolutely mandatory.
I think this organization is a really important national organization that brings a lot of physicians but also community people together. it certainly raises awareness, and it does raise research funds that allows people to move forward in trying to help patients in achieving that goal of curing them from cancer, but not only that, giving them a better chance at a quality of life.
They've been fantastic. I think that they're a great public face for the disease. They, again, have been really important in terms of raising the profile of colorectal cancer in the community. They're active in terms of funding clinical aspects of the work, screening initiatives. They're active in terms of funding research, again, at the basic side of things, so all the way from what we call bench to bedside.
The amounts of money that they have raised over a short period of time from a lay organization is really outstanding.
I think honoring a team really underscores what we try to do every day. I don't think any one of us looks after a patient in isolation. We have pathologists that work with us, radiologists, nurses in the operating room. None of what we do is alone. So I personally think it's really fantastic that you've come up with a team concept that that's really how our group works together. And I think we often help each other in the OR. We think about our patients together. And I think that spirit of putting a team together and honoring them is pretty great.
For GI cancers, this is the place to go. This is the place to train. When you have a team like that, you recruit people, you attract people as well to train, and you develop a reputation. And I think we have a pretty good one.
I think it's extremely exciting that Colon Cancer Canada has chosen this approach to honoring our team, really our family of people who contribute to cancer care at Mount Sinai Hospital. And I think that in an indirect sense, they're really honoring all of you who contribute to this effort.